Welcome to the Deep Dive. We're the place that takes those really complex topics, looks at the research, and tries to, figure out what actually matters. Today, we're tackling something that seems like a real paradox. Why would someone fight tooth and nail against doing something they genuinely want or need to do?
It's a fascinating question, and often what looks like just defiance is way more complicated. We're talking about a pretty intense neurodevelopmental profile. It's driven by really high anxiety and this pervasive need for control.
Right.
So our mission today is to move past some of the older labels like pathological demand avoidance, PDA, which can feel a bit loaded.
Pathologizing.
Exactly. And focus instead on what the current research and a lot of the community find more accurate and, frankly, more empowering, the pervasive drive for autonomy.
That framing shift feels really important. So we'll be using evidence-based research today.
Absolutely. We need to unpack this intense need for control, look at the sometimes quite sophisticated ways it shows up, and crucially talk about support strategies.
Yeah.
Because the usual methods, they often don't work here. They can even make things worse.
And we definitely need to clarify how this differs from other challenges, like what sometimes gets called failure to launch. They can look similar on the surface, maybe, but they're fundamentally different beasts.
Fundamentally different. We want to provide clarity, actionable knowledge based on science, but also, with compassion for anyone living this or supporting someone who is.
Okay, let's dive in. Terminology first. This profile, you said it's been recognized since the 80s.
That's right.
So why this big push now away from pathological demand avoidance? I mean, it sounds clinical, sure, but maybe a little harsh.
It does, and I think both people with lived experience and clinicians felt pathological really missed the why. Historically, yes, it was PDA or sometimes ED, extreme demand avoidance. And it describes this pattern: consistent, intense resistance to everyday demands. Simple things, complex things.
But the label itself.
The label points to the symptom, the avoidance, not the engine driving it. And the research is very clear now. The engine is overwhelming anxiety. This anxiety leads to an automatic, almost reflexive need for complete control over one's situation, to feel safe.
Okay, so the demand, any demand really, feels like a threat. And the avoidance isn't a choice to be difficult. It's more like a self-protection reflex kicking in.
Precisely that. It's a survival response. The research strongly confirms that clinical levels of anxiety are central here. So the newer terms, pervasive drive for autonomy, or sometimes persistent drive for autonomy, they reflect that understanding. It's not about being difficult. It's about reacting to a perceived, immediate threat to your own agency, your control.
That makes sense. You mentioned research, and our sources bring up self-determination theory, SDT. That seems relevant here.
Oh, absolutely critical. SDT basically argues that for us to thrive psychologically, we need certain basic needs met. Autonomy, feeling like you have control and choice, is a huge one, along with competence and relatedness.
So if that core need for autonomy is constantly blocked or feels threatened,
the whole system goes into defense mode.
Ooh.
For someone with this neurodivergent profile, that need for autonomy isn't just a preference. It's incredibly acute. It's pervasive. So any external pressure, even subtle expectations, can register as a major threat that must be resisted, often automatically before they even consciously process it.
Okay, quickly then, where does this fit diagnostically? Is pervasive drive for autonomy something you'd find in the DSM-5 or ICD-11?
No, not as a standalone diagnosis right now. It's not in the main classification systems yet. But, and this is important, it's widely recognized by clinicians and researchers as a real, challenging, and distinct behavioral profile.
Often seen with.
Most often within the context of autism spectrum disorder. There's still some debate, is it its own unique syndrome or a specific way certain conditions overlap? But there's definitely consensus that this pattern of behavior is real. It's different from just being oppositional, and it needs a very specific kind of approach.
Okay, let's get practical. When we talk about demands triggering this avoidance, what actually counts as a demand? It's obviously more than just being ordered around.
Oh, much more. The research points to basically 3 kinds of demands that can set off the anxiety and resistance. First, you have the direct demand. That's the obvious one, right? Brush your teeth, finish your report, a clear instruction.
Okay, standard stuff.
Then second, and this is where it gets really tricky for people to understand, there's the internal demand.
Internal, like what?
Like your own body's signals, hunger, thirst, needing the toilet, or even just the mental effort of deciding to start something, willing yourself to do it.
Wait, so feeling hungry can trigger avoidance? How does that work?
It sounds bizarre, I know, but think about it from a control perspective. If your body suddenly says, you must eat now, or you have to go to the bathroom, that can feel like your body is hijacking your autonomy. It's imposing a schedule, a demand from the inside. So resisting that feeling or delaying responding to it can be an attempt to maintain control, even over bodily functions. It's about the transition being forced, not chosen.
Wow. Okay. And the third type.
The indirect or implied demand. This is huge. It's basically any expectation, perceived or real. Someone asks you a question, that implies the demand for an answer. A bill arrives in the mail. Implied demand to pay it. An appointment in your calendar for next week. That's a future demand looming. Even seeing unfinished work can feel like a demand.
This explains so much. It's the pressure of the expectation itself.
Exactly. And here's the really counterintuitive part we need to stress. The demand does not have to be unpleasant.
Right. You mentioned this earlier. Things they actually want to do.
Absolutely. This is a key feature. Someone might be incredibly excited about going to see a movie or getting a new game, but the moment it shifts from a fun possibility to a definite plan, an expectation,
We are going to the cinema at 7 p.m.
that switch can flip. Suddenly it feels like pressure, an obligation, a loss of autonomy in that moment, and the avoidance kicks in, even for something they were genuinely looking forward to. The expectation itself becomes the threat.
Okay, so how does this resistance actually look? You said it can be sophisticated, not just, shouting no.
Right, because often the goal isn't outright confrontation. It's more about evading the demand, negotiating control subtly. The research highlights some common patterns. One is using fanciful excuses, really imaginative, sometimes quite elaborate or even absurd reasons, like, I can't put my coat on because my arms are made of chocolate and they might melt.
Are they aware it's an excuse, or is it more like a panic-driven creative deflection?
It's generally seen as the latter, a highly creative, almost automatic way to try and regain a sense of control when feeling overwhelmed by the demand's pressure. It's not typically malicious, it's more like verbal self-defense born out of panic.
Okay, what else?
Distraction or diversion, changing the subject abruptly, showering the person making the demand with compliments, or sometimes creating a minor crisis, knocking something over, suddenly needing help with something else entirely, anything, to shift the focus away from the original demand.
To an outsider, that could sound quite manipulative, though. Creating chaos to get out of something. How do we tell the difference between that and just bad behavior?
That's the absolute key, isn't it? Understanding the driver. If the behavior is fundamentally driven by anxiety and a desperate need to reduce that feeling of being controlled, the goal is psychological survival, not social manipulation for gain. Treating it as deliberate misbehavior usually backfires because you increase the pressure, which increases the anxiety, which increases the resistance, often in more extreme ways.
Right, it escalates.
It does. We also see passivity or withdrawal. The person might suddenly seem to go limp, unable to move. Or they might just physically walk away or retreat into their own thoughts, into fantasy, just disengage completely.
And I guess sometimes it does become more overt.
Yes. Aggression, things like hitting, shouting, throwing objects, that's usually seen as a last resort. It often happens when the other, more subtle strategies haven't worked to remove the perceived threat of the demand. It's less about anger and more akin to a panic attack response. Overwhelm.
And the impact of all this, it must be huge,
Yeah.
especially in certain environments. You mentioned school distress earlier.
Yes, school is a classic pressure cooker for this profile because it's not just about direct commands like, do this worksheet.
Yeah.
School is a relentless stream of indirect demands. Sit still, be quiet, transition smoothly, wait your turn. Understand social cues, manage group work, keep up academically all day long.
That's an expectation.
Constant. And that cumulative pressure just overwhelms the person's capacity to cope. It leads to intense emotional dysregulation, anxiety, meltdowns, shutdowns, and often significant problems with attendance. But it's rooted in that emotional distress, that overwhelm, not simply refusing to go. The research suggests this kind of school distress often becomes really apparent around age 7 or 8.
Now, thinking about older individuals, teens or young adults,
Yeah.
this pattern of avoiding responsibility, struggling with daily tasks, it could be mistaken for something else, couldn't it? Like that term, failure to launch.
Absolutely. And making that distinction is critical, especially when thinking about support or therapy.
So how do we differentiate the pervasive drive for autonomy profile from failure to launch, or FTL?
Okay, so FTL isn't really a clinical diagnosis, it's more a descriptive term. It's usually applied to young adults who seem overly dependent on their parents, struggle with independence, maybe lack motivation or seem stuck. The reasons can be varied, maybe fear, maybe learned helplessness, economic factors. The crucial difference with the pervasive drive for autonomy is the root cause and the history. PDA is understood as being rooted in neurodevelopmental factors and intense anxiety. And critically, it's a lifelong pattern. You usually see clear signs in early childhood, like that school distress we talked about. It's not something that just emerges in young adulthood.
So the origin story is completely different. FTL might be more situational or related to motivational issues, whereas PDA is this ingrained anxiety-driven neurotype.
Exactly. And that difference dictates the approach. If you try to use standard behavioral strategies like reward charts, consequences, increased structure, basically more external control, which might sometimes be suggested for FTL.
You're pouring gasoline on the fire for someone with PDA.
Precisely. Because those methods directly increase the feeling of being controlled, which is the core trigger for the anxiety and avoidance in PDA. It will almost certainly make things worse, sometimes dramatically so. The intervention for FTL might focus on building skills and motivation. The intervention for PDA has to focus on radically reducing perceived demands and lowering anxiety by increasing felt autonomy.
Which brings us to the big question. If those traditional directive methods don't work, what does? What does the evidence suggest is the cornerstone for actually helping for effective communication and support?
The single most important principle, the absolute foundation, is shifting the goal. You're not trying to make the person comply. You're trying to lower their anxiety levels and reduce their perception of being controlled or forced. It means moving away from direct confrontation and demands towards negotiation, collaboration, and just immense flexibility. You have to find ways around that automatic threat response.
Okay, so less demanding, more inviting, or collaborating. What does that look like in actual conversation? Give us some concrete strategies.
Sure. One key thing is using indirect language. Ditch the blunt commands. Instead of clean your room now, you might try phrasing it declaratively like, oh, the floor looks a bit tricky to walk on, or using I wonder statements. I wonder if we could find a space for these books. Or even depersonalizing it. Some people find it easier to tackle cleaning in small bursts. It just lowers the direct pressure.
Takes the personal confrontation out of it.
Exactly. Another huge one is humor and play. Especially, but not only, with kids. If you can embed a task within an imaginative game or use role play, it stops feeling like a demand. Maybe they can only get dressed if they're a superhero preparing for a mission. Maybe tidying up becomes a secret agent challenge. If the only way they can manage a necessary trip, say to the dentist, is by pretending to be an explorer charting unknown territory, you lean into that. It respects their need for autonomy while still achieving the goal.
Right, it reframes the obligation as a voluntary, chosen activity within the play.
Precisely. Third, and this is vital, offer choice and autonomy wherever humanly possible. Even small choices can make a huge difference. Do you want to do homework before dinner or after? Which task do you want to start with? Do you want to use the blue pen or the black pen? Giving control over the how, when, or with what restores that feeling of agency.
Makes sense. And you mentioned praise earlier. How does that fit? Usually praise is seen as encouraging.
It can be, but for individuals with this profile, certain kinds of praise can backfire spectacularly. High-pressure praise like, wow, you're so incredibly talented, or that was the best score in the class, you're brilliant, I feel like.
Setting a new, impossibly high bar, a new demand to always perform at that level.
You got it. It creates intense performance anxiety. So instead, the recommendation is to use more observational, noticing language. Focus on effort or process, not just outcome or innate ability. Things like, I noticed how focused you were while working on that, or I can see you put a lot of thought into organizing your ideas there, or you really stuck with that problem until you figured it out. It acknowledges their effort and builds competence without adding pressure.
That's a subtle but really important shift. And thinking about the environment, you talked about capacity fluctuating. How do parents, teachers, supporters manage that? The fact that stress builds up.
Flexibility is non-negotiable. Rigid rules, inflexible schedules, they are kryptonite. They massively increase anxiety and therefore resistance. You absolutely have to accept that capacity isn't fixed. It ebbs and flows based on cumulative stress, sensory input, transitions, everything. Just because they manage 3 full days of school doesn't guarantee day 4 is possible. That stress builds up like a debt.
So supports need to be adaptable.
Highly adaptable. It means having backup plans, allowing for downtime, creating low-demand spaces, maybe offering alternative ways to meet expectations when capacity is low, recognizing that pushing through often leads to a bigger shutdown later. And critically, we have to talk about the supporters. Caregivers, parents, partners, teachers need support too. Research shows managing this profile is linked to incredibly high levels of caregiver stress, anxiety, and burnout. It's exhausting.
So support isn't just for the individual.
No, caregiver training and support are essential components of any effective plan. And while sometimes medication might be used to help manage severe anxiety or co-occurring conditions like ADHD, it's never the whole answer. It has to be paired with these environmental adjustments and collaborative, autonomy-respecting psychological strategies.
It really paints a picture of needing a complete paradigm shift, moving away from seeing this as difficult behavior that needs correcting.
And toward understanding it as an automatic anxiety-driven response to feeling a loss of control. When you grasp that, the path forward changes completely.
So the core insight from this deep dive seems to be that this powerful drive for autonomy needs to be met with understanding and flexibility, not more control. That's how you unlock cooperation and competence.
Exactly. And what's really hopeful and supported by the broader research on autonomy support is that when individuals with this profile do feel their autonomy is genuinely respected, they often show more persistence, better self-regulation, and greater engagement. It's finding the right key. So maybe the provocative thought for you, our listener, is this. Where in your own life, maybe with yourself, maybe with someone you support, could shifting from demands and control towards curiosity and genuine autonomy support make a real difference?
That's a powerful question. And if you or someone you care about are seeing these patterns, the pervasive demand avoidance, the emotional dysregulation, maybe feeling stuck even after trying various therapies, getting a really deep integrated understanding of what's driving it, could be the first step towards real progress.
Edward Jenny and Associates specializes in exactly this. They offer psychotherapy and collaborative assessment, using sophisticated, integrated assessments to get to the heart of behavioral triggers and individual challenges much faster than traditional approaches often allow. Their whole approach is built on developing a scientific and empathic understanding, working collaboratively with clients to create personalized guidance and help them move forward.
So if this resonates, you can reach out to Edward Jenny and Associates. They offer a free consultation, and you can request an appointment through their website to explore how they might be able to help.